What is the situation with HIV? Because no one seems to be talking about it anymore. You barely read an article about HIV except on AIDS Day, or because there's a medical magazine or journal that features the subject matter.
Actually, the current situation of HIV/AIDS in the Philippines is that we are getting an increase in the number of new cases. It just happened na natabunan siya ng pandemic ng COVID, and then at the same time here comes the monkeypox, although hindi pa siya masyadong pinag-uusapan, but there were actions and strategies taken on the ground by the different stakeholders in order to claim again the focus on HIV in the Philippines. So currently, as of April, we have a total of 1,198 new cases. And overall, from January of 1984 to end of April 2022, we have around 98,000 new total number of cases in the country. And out of the 98,000, there are only 50,000 or 59,000 who are enrolled on antiretroviral treatment at the moment. So we have an increasing number. The UNAIDS describes the situation of HIV in the Philippines as fast and furious. So if you try to look at the records of the Department of Health Epidemiology Bureau, sometime in 2014, there was a 140% increase on the new cases when we started having it from 1984. So that's the current situation. So that's why we need to do our acts together, come up with innovative approaches in order to do a lot of testing for those who needs to be tested, for those who need to know their status, and then immediately link them to care, and particularly link them to treatment, which we call antiretroviral treatment. So that's the current situation in the country now.
In terms of acceptance and people actually going, ay, magpapatest ako, mahirap na. Nadulas ako no isang linggo, magpapatest na. That sort of stuff, okay? Are people more aware and proactive about it?
Okay, we have a concern about getting aware or getting the awareness about HIV. But the question there is, a lot of people are getting the awareness for HIV, but translating this awareness into an actual action to go to right the doors of the testing facility and to get themselves tested is a big question. So we need to do a lot of push, not only for education, but rather innovative approach in providing the testing. So like, for instance, what we're currently doing now, and it is happening everywhere where testing is available, we have groups of people who come to the areas to do community outreach and invite people to come over in coordination with the barangays. We have to coordinate with the barangays considering that we're still in this COVID pandemic so that we are able to comply with the COVID protocol. And at the same time, we are able to provide the services for those who need to be tested. So we go to the place where the services are needed. It's just like saying, let's bring the mountain to Muhammad where Muhammad cannot come over to us. So we come to the place.
Okay, now the question is, who's getting infected nowadays? Because in the early days, in the 80s, they were saying it was the gay community, that it was men to men, and then it became heterosexual, and then it shifted to transient individuals, overseas workers, seafarer. Now, last time before COVID, what really worried me is they were like, tama ba ako, 16 years old, young adults. What's the profile now of the population that's getting infected with HIV?
Okay. Everyone actually is vulnerable. It has something to do with the behavior we're engaged in. But currently, our statistics shows that majority of those who are newly diagnosed and are infected are currently male. And these are, majority of them are men having sex with men. who get tested for HIV and are being linked to care. And then at the same time, your question on the age, with the April 2022 report alone, we have around 20% of those of the 1,198 who belong to the 15 to 24 age bracket. So we're getting younger because the parameter for us there actually is teen pregnancy. If one gets pregnant or a boy gets a girl pregnant, yeah, it means to say that they're really engaging in unprotected sex.
Okay.
So that's one parameter or one indicator for us that the younger they are, very much open to sex, the more that we need to provide them with a comprehensive sexuality education. So we have as young as 15 and we have as old as 70 years old. So that's the current situation right now in terms of the age group.